Connecticut's Back to School Authority is sponsored by Yale New Haven Children's Hospital, one of the best in the nation.
It's Friday, the day we set aside to get answers to back-to-school questions that you've sent us. So we start today with a question from Patricia in Hartford, who's concerned about her granddaughter's return to school. And she asks, what precautions are being made for children with medical conditions? My granddaughter has asthma. Will there be times for the children to have relief from their masks? 8 hours is quite a long time. We took that question directly to Hartford Public Schools spokesman John Fergus, who tells us there will be at least 5-minute mask breaks every hour for every student in grades K through 12. And he says that if a family has a medical reason that wearing a mask would be detrimental to their child's health, that family should reach out to the specific school the child attends to talk with the school nurse about options. He says they've already been reaching out to students who have certain medical conditions. He adds that students do have the option to shift to an at-home online learning experience at any time. So now to our next question. It comes from a viewer in Manchester who says many schools that have reopened around the country already have cases and are citing privacy rules from even confirming a case. Will districts and schools be directed to report the number of cases via immediate contact, like email, without identifying the individual versus sending out letters through the mail? So for that question, we reached out to the State Department of Education Department spokesman, Peter Yazbak, who says that each district has its own communications plan, but the expectation is that an email or even a robocall would help inform the community if a case of COVID is detected in a school. He adds that CDC guidelines require that if there is a confirmed diagnosis in a school, the local health department becomes involved and works with the school system on contact tracing and on school dismissal decisions. The Americans with Disabilities Act and Family Education Rights and Privacy Act, or FERPA, does require confidentiality and protects the privacy of anyone who were to come down with COVID. So now to our last question for today. It comes from Kim in Berlin. She writes, why did the governor think it was a good decision to allow each school district to have its own plan for reopening? I have elementary and middle school aged children in one district, yet work in a different district. She says she's now forced to maybe take leave because of this and says educators with young children have been put in an awful position. The Department of Education spokesman says superintendents have the flexibility to select their own operating model for the fall because they're in the best position to determine which model is safest for their schools based on the community's own unique considerations. Now, the department agrees that childcare is a huge factor that is being discussed nationally for both teachers and all working parents returning to full-time work. They want you to know the Office of Early Childhood, or OEC, set up a 211 line to specifically support educators seeking childcare options. The OEC and the United Way of Connecticut have also established a phone line to help educators find childcare. That number is 860-756-0864. And finally, state education officials do want school districts to work with city and town leaders to look at community spaces like the YMCA or Boys and Girls Clubs to provide supervision for any children who might not be in school due to a hybrid model. Well, that's it for today's Q&A. You have those questions answered, but if you have any others you'd like to get answered, you can send them to us via the Channel 3 app.